Hello dear students, welcome to another important topic for exam perspective, that is charge syndrome. So what is charge stands for? It includes variety of disorders, as for example C stands for coloboma, H is heart disease, and in the heart disease most common is tetralogy of Fallot, again that is a congenital anomaly. A stands for choanal atresia, R is for the growth retardation, G stands for genital hypoplasia, and E is for ear deformity. So what are the four major diagnostic criteria for the CHARGE syndrome? First is ocular coloboma. What is coloboma? It is a congenital eye condition where part of the eye's tissue is missing or causing a gap or defect, that is known as ocular coloboma. Second is choanal atresia. In this, there is deformity at the posterior end of the nasal cavity, that is known as nasal choana. There can be stenosis or there can be completely blockage. Third is cranial nerve anomalies. In this, most common anomalies are from olfactory tract or affecting the facial nerve, and there can also be sensory neural deafness. Coming to the ear deformity, most common varieties are lobe or cup-shaped pinna, ossicular deformation, and otitis media with effusion. Now, what are the minor criteria? There are four minor criteria for the CHARGE syndrome. First one is cardiovascular malformation, as we have discussed in previous slides. Most common variety is tetralogy of Fallot. Genital hypoplasia in males, most common is cryptorchidism. There can be also cleft lip or cleft palate. There is a condition that is known as charge facies. So what is charge facies? In this, there will be a particular appearance of the face of the patient affected from the charge syndrome. That will be very characteristic. Like patient will be having sloping forehead and flat nose dorsum tip. So this is typically known as charge facies. There can also be growth deficiency and there can also be developmental retardation in the child. Now coming to the investigation part, what investigations we can order to diagnose charge syndrome? We can do cold spatula test. In this we can check the nasal patency or patency of the air passage to rule out choanal atresia. We can also do flexible nasopharyngoscopy. We can do methylene blue dye test. All these tests are basically for the choanal atresia. As in the nasopharyngoscopy, we generally pass a small nasal endoscope to see the passage and to see the nasopharynx and all the parts, but we are unable to do so in the patients of choanal atresia. In the methylene blue dye test, we pass a dye and track the passage of the dye into the nasal cavity and nasopharynx. Also, we can go for HRCT, we can do cardiac echo to rule out tetralogy of Fallot. We can do renal ultrasound and also we can do audiological assessment to rule out the sensory neural type of hearing loss. So that was all about CHARGE syndrome in brief. It is a very important question and it often comes in the exams as a short note. Now you have to tell me in the comment section about a condition that is known as NOWCA. So do read about this NOWCA and write down in the comment section. I will wait for your answers. Thank you guys for the joining.